Introduction to Vaccine Access. This first lesson aims to give you the basic concept of what is vaccine access. How can it be defined, what are the subjects it can be extended to, and what are the limits of vaccine access. But before having the definition of what could be vaccine access, it is important to remind you that we still observe a high level of human death worldwide due to preventable infectious diseases. And we know that this death could have been prevented thanks to life-saving vaccine. The question is, if we have effective vaccine, why is the death rate due to preventable infectious disease this high? Because not all population around the globe have access to vaccine. About 19 million children from low-income countries do not have access to vaccine. That is why we have to understand what vaccine access is and to think of different ways to make it equal in all countries. If you take a minute to do a small brainstorming about vaccine access, there is some word that can come to your mind, such as prices, programs, demand, procurement, and availability. However, having access to vaccine means that nationally a country has adequate supply, procurement, and distribution of all licensed or pre-qualified vaccine and a will for uptake based on well-set program and national schedule. Unless all these different parameters exist in one nation or all nations, vaccine access will never be optimum or equal. As in every field, the world can be separated into two groups, developed and developing countries. The developed world generally has highly qualified regulatory authorities and efficient supply, distribution, method, and policy. On the other hand, most of the developing countries depend completely on aid from international organizations or are in the process of reforming and investing in their health system and programs. Nonetheless, here this division is too general, and there are exceptions. Take India as an example. While classified as a developing country based on a relatively low Human Development Index, India has the world's largest vaccine manufacturer by number of doses produced and sold globally. In general, a developed country's access system is one of the following. It can be completely centralized vaccination system where all licensed vaccines are government funded. As the procurement is by government tenders, it imposes price control of the qualified vaccine. Thanks to the vaccination schedule implemented by the government, parents bring their children at the right moment to receive vaccine doses free of charge. In this second system, partially centralized, only mandatory vaccines are administered free of charge. In the case of other licensed vaccines, the Health Committee on Vaccination provides advices on which vaccine should also be administered and offered, free of charge, to risk populations. The last system is the decentralized system. There is no government input here, and thus price control are reduced. Sale are to the private market, insurance company, individual physicians that pay and purchase vaccines. Administration of which vaccine is a parent and physician decision. Nonetheless, Health Committee which advise on what and when to administer exist, and their decisions, like other committees, are based on what is publicly important. Now, what about the access situation in developing countries? In this second category, access is even more heterogeneous and complex. Taking extreme case scenario first, in some of the developing countries, health systems are poorly functioning with poor stock management, handling, storage, or a clear lack of logistical support and infrastructures. In 10 of these countries, there are populations completely unreached, all in Asia and Africa. Majority of this resides in rural areas with no access to health facilities. Others either reside in zones of conflicts. However, access in these countries is mainly and mostly importantly limited by the lack of secure funding from the government and an extremely low purchasing power among the population. Therefore, immunization in this country depends mostly on the effort of international non-governmental organizations. like United Nations Children Fund, UNICEF. UNICEF is one of the leading players in global immunization effort. It supplies vaccines to more than 40% of the world's children, and quarter of its annual budget is devoted to immunization program and supply. Through its direct contact with partners, UNICEF helps in facilitating introduction of vaccines in different low-income countries. It basically ensures children's efficient, safe, and sustainable access of vaccine and access to immunization services. There is also Gavi that aim to introduce new and underused vaccine and increase routine immunization coverage in Gavi-eligible country, meaning the world's poorest country. Basically, Gavi leverage financial resources and expertise to purchase at very low price. Gavi works with the developing country, supporting them financially and helping them to develop its expertise to the point where they can pay for itself and drop out of Gavi eligible lists. The third organization is the World Health Organization. Since immunization is a health-related issue, it is no surprise that the WHO focuses on improving access to vaccine and immunization services for all the population. Besides ensuring pre-qualification for countries with weak national regulatory authorities, WHO provides vaccination schedule recommendation. But over the year, it developed several strategies and guidance for government worldwide to ensure a sustainable and reliable vaccine delivery system. Some of the main strategies developed over the years by WHO are the Expanded Program on Immunization, EPI, initiated in 1974. EPI provides a set of guidelines according to which national governments create and implement their vaccination programs. This program's positive impact is reflected by a decrease in diseases and death incidence caused by vaccine-preventable diseases. The second one is launched in 2002. This strategy was developed to lengthen immunization delivery at the district level through encouraging people to adopt practices like the identification and resolution of local problems, organization of routine vaccine delivery services, and involving the community in insurance of adequate functioning services. The third one is the Global Vaccine Action Plan. Endorsed by WHO in 2012, GAP includes different strategy objectives that aims at preventing millions of deaths by 2020 through the accelerate access to vaccine where they are needed. After this talk about vaccine access and the different stakeholders involved in it, is it possible to achieve equitable vaccine access? We will let you answer this question, but you should keep in mind these 5 factors: supplies, procurement, distribution, pre-qualification, and programs. Indeed, these factors need to be strengthened to ensure equitable vaccine access. For example, there is a high demand of cholera vaccine, but not enough doses are produced per year and by only few manufacturers. What happens with countries that drops out of Gavi lists? They still have difficulty to purchase the vaccines. And an efficient distribution of vaccine is also an important barrier to vaccine access. And finally, it exists some institutions that can help ensuring vaccine spreadification and good vaccination programs for countries in difficulties. To conclude this talk, it is important to say that yes, there is a lot to do before to reach an equitable vaccine access. But thanks to the help and actions of all the different stakeholders, vaccine access is a reachable goal. As a take-home message, you should keep in mind the definition of vaccine access, the difference between developed and developing countries, and the system to access to vaccine. And finally, each and every year, progress are done to reach an equitable vaccine access between all countries, thanks to many different actors and organizations. Still, there is some limits that we need to overcome. Thank you for your attention.